Hi, this is part two of the Patient-Centered Communication lesson guide for Module 3 of the Communication Strategies course. We left off after looking at Assess Patient Perspective and Exchange Information in Part 1. I want to move forward in Part 2 and begin looking at Attend to Emotion, and specifically the tool NURSE. As you can see, as with other mnemonics, then it's listed per letter some of the behaviors that you can utilize in a conversation. However, it is not a hierarchy, and you're not required to go from N all the way to E in a given conversation. You may only use one letter or one behavior out of the NURSE mnemonic in a given interaction to attend to emotions with an individual. But let's go through the mnemonic. So N stands for name the emotion. That's often really frightening and especially difficult if they're difficult emotions such as anger or frustration or helplessness. But go ahead and try to name the emotion. Even if the individual doesn't agree that they're angry or sad or that this is hard or whatever it is, go ahead and name the emotion because it gives them the opportunity to know that you're listening, that you're trying really to understand what this means to them and how they're feeling about it, whatever the conversation is. So, when you name the emotion, you don't have to be straightforward or blunt. You can say something such as, it sounds like you're worried about blank. Or, in your situation, often people would be angry with what's happened to you, or something of that nature. It's okay if you're wrong when you name the emotion. Let them tell you what they think the emotion is, and accept their explanation of how they are feeling. The U stands for understand, and it's a reflection back from what either you've discussed or what you've talked about or what you think you're understanding from what they're telling you as you're digging deeper into those inner meanings. So something along the lines of, I think I understand that you're worried about whatever, or this must really be hard for you. R stands for respect. And the best way to think about respect here is to think of it as praise. Anytime we're in a conversation with someone, we can usually find something that we can praise them about, even if it's very small. And it's really important to give them that recognition of what they've been doing correctly with whatever they're dealing with. So for example, if it's a loved one of a patient that you're caring for, then you can say, I am so impressed with how well you've cared for XYZ. Or if it's the patient themselves, then you can say, this is really hard stuff you've been going through, and I'm so impressed with how you've come through it. Something to let them know that they really have been doing a good job and that it has not gone unnoticed. S stands for support. Again, this is a supportive empathic statement and something that shows that you're going to be there for them as they go along this path that they're currently in. So something along the lines as, I'll walk this journey with you. Or, I know this is tough, but I will find whatever answers I can find for you. I may need to speak with other colleagues to make that happen. And then E is explore. This is where, as part of the conversation, you really want to understand a little bit better, or maybe they've given you an opening, something along the lines of, I'm not sure if I want to continue doing treatment. And so what you can do is use Explore to say, I can see that you've been thinking a lot about that. Can you tell me more? Again, that tell me more tool that we've used in the past. Okay. After you've had a chance to attend to emotion, then you may not need to go anywhere else. Sometimes in conversations, you may need to exchange information very briefly, or you may need to just be with the individual and allow them to feel the emotions that they're having. Attend to emotion may be the only bubble And the nurse tool may be the only tool you need to do as part of a conversation with someone, especially caring for someone who has cancer. One of the things I want to take a chance now to explain is that of the 3 bubbles that we've looked at, you've seen lots of different examples of things that can be said. Keep in mind that the words that are on the slide are really from what either I or Dr. Gustin have generally used in the past, and it's not meant to be the only words you can say. You can find the words that feel comfortable for you and the words that make sense in the conversation for you. It doesn't have to be the words that you've seen on the slide. As long as they convey a similar meaning, there's no reason why you need to repeat or say exactly what we've listed as examples. Now, we're going to move toward the 4th bubble, which is quite difficult, called manage uncertainty. In manage uncertainty, we've got 2 techniques, the hope-worry technique and the I wish statement. Hope-worry can be used in a couple of different ways. So it can be used as a warning shot and reflect the uncertainty of a given outcome, such as we're hoping that putting your loved one on the breathing machine is going to allow his lungs to rest for a while, and then we can get him off the breathing machine. But we might be worried that he's not making the progress that we would hope for if he's not making some changes in about 3 to 5 days. Okay? Or, as on the screen, we're hoping these treatments will help change the course of your husband's illness, but we are worried that all of his medical problems may be too much for him to overcome. So kind of giving them a warning shot that we're going to try this, but it may not work. The other way to use hope worry is to do it as a prognostic awareness. So, we're doing treatments and we're hoping for improvement with these treatments, such as reducing the cancer or shrinking the cancer. And we'll let you know as we see the scans if there's an indication of a worsening condition. I wish statements are those statements which kind of relax the power struggle that we have between patients and providers, because there is a change of power by being a clinician versus being a patient. And anyone who's been in that patient role knows how different it is to be a patient. So in I wish, it's kind of like wishing on a star. We appreciate that we're all human and that we're all doing the best that we can. And it cultivates that partnership between us so that we can work together on whatever problem is happening for our patient at the time. So one way of using I wish statement is to say, I wish I had more answers for you as to why your body's not responding the way we had hoped. Just to let them know that we don't know, you don't know, we're all struggling to try and figure out what's going on with your particular illness, but we're going to continue working to see if we can find a solution and to be there with you. So it's a particularly useful tool when anger and helplessness and frustration. So when they're really angry and there's really nothing that we can change with the situation, then you can say something along the lines of, I can see you're really angry. I wish I had the ability to take your anger or your pain away. All right. That brings us back to the elements again, and we're going to spend just a couple of minutes on the center bubble, which is kind of in the middle of the 4 bubbles for tools for shared decision making. And again, we looked at the SPIKES protocol by Dr. Buckman in the Module 2 lesson guide. So let's take a look at a tool called Value that you can use with families in a family meeting or at the bedside with families. This was developed by a PhD nurse researcher with Dr. Curtis's group at the University of Washington, Patricia Treese. And you can see that, again, as the mnemonic indicates, by the letters. We're going to value the family members and appreciate what they have to say and what they bring to the care of this individual. A then is acknowledge their emotions. You can name the emotions for them as well, but certainly acknowledge them and to praise them whenever possible for the job that they've done. We're going to do that by active listening and digging a little deeper into those meanings, very much like we've been doing with our patients and what we talked about before. U is understand, and here we want to understand the patient through their eyes. So finding out from the family who the patient is, what they love, what's important to them, and what we can allow them to bring to the bedside to help the experience for the patient while they're either in the hospital or with us in a different situation, such as for chemotherapy. And E is eliciting those questions from the family, finding out what's important to them and what their concerns are. They have a different perspective about the patient than we do, and it's important to find out from them what things they're worried about or what concerns that they have. Okay. This is the end of the lesson guide, and we're going to have lots of opportunities to practice. One of the things that I would like for you to do is to think about the 5 elements here and think about what are some words or phrases that you might use for a given tool, such as ask, or tell me more, or respect or praise in the nurse mnemonic. And think about how you would say those and kind of get yourself a little preview of some words or phrases that make sense, or maybe words or phrases that you use often already in conversations. And we're going to talk about those as we go through the module and through the course. Thanks so much.